to demonstrate the opposite side PSA for a right-handed operator. So my clinician is going to show you retraction. So again, she's going to place the gauze in the corner of the patient's mouth. She's going to reach past the gauze with her index finger and touch the maxillary tuberosity with the tip of her index finger. Then she's going to slide that finger right up into the vestibule, kind of pushing the ramus away from the alveolar ridge and having the patient close slightly and shift away from the clinician. We want to keep our finger back so we really open that vestibule up. Then she puts her thumb way up high on the patient's cheekbone, and she's going to hook this index finger up again, making that C so that she can really open that vestibule. Then she's going to want the patient to lean towards her just slightly so that she can really see the site. Okay, now we're going to go ahead and pick up the syringe. So we're picking up the syringe, making sure the big window is visible, the harpoon is set. We're going to just kind of gently wedge that cap off and place it on the counter. Okay, so retraction again. She's going to reach past the gauze, touch the maxillary tuberosity, keeping her finger in that vestibule, having the patient shift away from her, lean toward her a little bit. Perfect. Now, really important on the opposite side PSA that you go in the one position and then swing out to your finger. So get that needle past the lip, past your glove, and then you're going to drop 45 degrees and you're going to bring that syringe right out to the finger, and it should line you up perfectly into where the alveolar ridge and the maxillary tuberosity intersect, and that is your penetration site.
Minimum penetration site?
I see, proceed. And you're going to advance half the length of the needle, and then you're going to bring the barrel towards the patient's cheek or shoulder, using your retraction finger to push the barrel downward, and the needle needs to go upward. And then you're going to advance to 4 millimeters showing from hub to tissue.
Maximum depth and angulation?
I see, proceed.
Aspirating?
Waiting 3 seconds.
Negative?
I see, proceed.
Depositing.
Okay, you can go ahead and withdraw. So when you withdraw, pull slightly out and then lift the syringe back up so that you don't ricochet and scrape the tissue. Perfect, and then we're going to go ahead and cap our syringe and give our patient a rinse.